After 2 months of not being able to provide dentistry, I'm reopening Park Dental Care. My team and I are desperate to get back to helping you. However, dentistry is going to look very different for a while. We're totally changing the way we provide care to look after you and do our bit to control the COVID-19 pandemic. Our guiding principles are going to be minimising the number of people in the practice at any one time, minimising the proximity of people in the practice, minimising the amount of time people are close to each other, minimising the messiness of what we do, and maximising the efficiency and the safety of the care we provide you. Your dental care will be delivered in 3 parts. It'll look like this. In the morning, you'll get a telephone call, somewhere between 8 and 9 in the morning. Then we'll meet and carry out your appointment at the surgery. This will be for a maximum of 15 minutes. And then in the evening, we'll follow up with a video consult. We normally use Zoom. If you can't use this format, let myself or one of my team know and we can plan something else. As part of the evening's telephone or Zoom consultation, we'll discuss what we found in your mouth, any diagnosis, any plan of action, whatever we'd recommend. The principle we're working to is to minimise the amount of time you'll need to be at the practice and will need to meet face to face. This is for your safety, and the efficiency with which we do this will keep you safe. For the safety of everybody involved, it's important you understand how this is all going to work. So on the morning of your appointment, between 8 and 9 a.m, we'll give you a call. We're going to ask you about what's going on in your mouth. All the normal questions about your comfort, how you've been, can you eat comfortably, any bleeding when you brush, all the questions we'd normally ask. And we'd also invite you to ask those questions you'd normally ask when you come and see us. We'll also ask you to confirm your medical history. So your general medical health, the sort of questions we normally ask on a paper format when you attend the practice. We'd like to make sure we understand your background medical health and how this can affect things. And then we'll ask you about your COVID experience. You and your household, how you've been during lockdown, whether any of you have been affected, and we'd like to establish what your risk of being a carrier at the moment is. At the end of that, we'll confirm what time your appointment is and that it is safe and appropriate for us to meet during that day. We do not have a functioning lounge at the moment, and we do not want to keep anyone waiting or have people sharing space. Please arrive promptly at the time of your appointment. You'll be admitted to the building and your temperature will be taken. Should your temperature be raised, we'll ask you to postpone the appointment. Assuming it's safe to continue, you'll be asked to use a hand sanitizer and then taken straight to the treatment room. Whilst in the dental chair, you'll be asked to rinse your mouth, and then your dental examination will commence straight away. If it's safe and appropriate to provide treatment while you're with us, we'll do this if we can within the 15-minute window we feel is safe and appropriate. My staff and I will wear appropriate PPE for our and your protection. There won't be much time for a discussion, so we'll be scheduling an evening consultation to have all the discussions we'd normally have surrounding your care. If you're attending with a child, we ask that you just attend the 2 of you. If the appointment is yours, we ask that you attend alone. Anyone else, wait in the car, or if the weather continues to be this good, to take a walk. At the end of your assessment or treatment appointment, we'll again ask you to use a mouth rinse and a hand sanitizer. And then you'll be escorted from the practice and given a bag of goodies that we'd recommend for you. The things we might normally provide, TP brushes, other interdental aids, special gels, etc. We'll also confirm the time of the evening consultation at which we'll do a proper discussion. The last part of your care is the consultation we'll carry out on the evening of your appointment. We're normally using Zoom for this, and we'll have the opportunity to discuss all the things we'd normally have done at the practice. What I and my colleagues have seen in your mouth, any diagnosis, any treatment we'd recommend, any particular advice we have for you in looking after yourself. We'd also recommend what treatment may be appropriate to look after your health and how safe or appropriate it may be to carry this treatment out sooner rather than later, or how safe and appropriate it might be to delay this. We may then propose treatment and follow up in writing by confirming the treatment we've discussed. I'm providing this service at the same fees that I was charging at the beginning of this year, which makes this a loss-making process for me. I therefore ask that you help me by settling your invoice as soon as possible, meaning that same week. I sincerely hope that I can return to providing a normal dental service like you and I were used by the end of this year, and that my ability to look after you is returned. If you or any of your family are particularly vulnerable to the COVID virus and you feel we should know about this and we can take special care of you and make your dental treatment the safest it absolutely can, I'd love to hear about this. Please call us and explain your situation. There are a number of ways we can help you, keep you safe and reassure you. Telephone us 0115 9101 447 and we're very happy to discuss this. We look forward to looking after you. Thank you.